CEO Live Talks.
I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. I'm your host, Dr. Swannie Jett, CEO Live Talks, and this is episode 2 with Mr. Stewart Bridgman. Well, I guess the question would be, what is really waste? What is really fraud?
Right.
Because let's say government doesn't do what we're talking about, right? They don't help people in society as they should. Every time we take that away and it's privatized, then it becomes, they make more money.
Right.
So all the services, I've seen it probably about 15 years ago, we took elements of the government and privatized it. It cost the government more money to do that.
Right.
So, I don't know if that's the solution.
So, I think that I talked about this when we were in the business school.
Right.
Anytime that you have a for-profit for healthcare, if you're making a profit, shareholders are making profit off of human suffering, that's just against my values, right? That's not my values is. Now, I understand that that's
It's not mission orientated.
That's how it's working.
Yeah. But it goes against everything in the fabric on how you were raised.
Correct.
So it's a direct conflict, and you will have internal trauma, and then you'll be applying therapy to yourself.
Well, you have to apply therapy to yourself every day. We all have to.
Right.
But I also think, economically about when there is an economic bubble that pops, right? There's typically jobs during that time that are not affected by that downturn. So when we had the housing crisis, healthcare was not affected. Healthcare has done well. So, and that could be the next economic bubble. So I think about that. So I've always thought myself, what would it look like for the healthcare bubble to pop?
Right.
And so insurance companies seem to be well. Doctors are doing well. Therapists. What happens if that? And so I think the risk of the Medicaid dollars or whatever is we all benefit from those Medicaid dollars because we are able to go to the doctors who are paid by that. And if we think about it, if you go to the doctor, what percent of their patients have government-run health care? They got Medicare, Medicaid, VA benefits. How many people work for city government or state government, police departments, EMTs, fire departments? 67% are already on some kind of government health care.
Yeah, that's true. I have a burning question.
Okay.
And I'm sure you sit back and contemplate life and the things that's going on. But I focus on population health, so I can't treat one-on-one, right? Because treating a patient one-on-one, there's so many issues, we have to have a preventive approach. So thinking about mental health, we can't just continue to treat one-on-one. What can we do preventive-wise as a society in dealing with mental health?
First of all, I think sometimes there's a lot of programs to help families with early interventions. And you can do everything as a parent to your best of ability. And for mental health diagnosis, sometimes it's happening during adolescence. So the theory is that you have all these brain cells because your baby brain is just super wired. And then your body starts thinning out some of those brain cells. So for someone with schizophrenia, the frontal core where all your thinking takes place is over-thinned, and the inner part of your brain is not thinned enough. And so this creates this wiring of your amygdala. It would say it's danger, danger. It goes right to your brainstem, and it's not going to your frontal lobe. So at Bridgehaven, we have programs where we teach. I think of Bridgehaven as a gym for your mind, and so we're exercising that mind to get them to use that frontal lobe to think about stuff. So first of all, it's just going to happen to some people. It just happens as it's just biological, and it's part of their genetics that can lead to this mental illness. But what happens to us as we put stress on ourselves to fight the voices or fight the negative thoughts that we're having, it only makes them worse.
Some people would say that's just the devil.
Yeah.
So let's break that down.
So I think, we go back to just as a society, love ourselves for our faults, and to treat each other as people. And I think about it, like kids learn so much by playing and having fun. And so I don't want, when you're stressed, you tend to make bad decisions. When I'm stressed as a CEO and I'm worried about stuff, that's when I'm most likely going to make a bad decision.
So what do you do to counter that? I mean, because you're stressed, and then I see road rage now. I've seen more road rage than ever before. People just got the car, start shooting each other. Like, what the hell?
I have my mentor at UofL, and I drive down to UofL, and I talk to him about the stressor. He doesn't have my stress.
Okay.
And it was just, every time I've talked to him about something, it's like the direction I want to go is exactly the wrong direction. It's just like, and he's like, Steve, why would you do that? That's really stupid. And you're like, yes, it is. And so, learning from someone like that is been really helpful. So to me, it's like, okay, lower stress at work so that we can all learn, we can all move forward.
Right.
I have to learn our members who are our clients, our patients. I have to tell them, just let's lower the stress, have a little fun here today.
So I have another burning question.
Okay.
It's a burning question, baby. Can you recover, from mental health?
Yeah. I have members, we have the Center for Peer Excellence. And their job is to provide technical assistance for peer supports all over the state. And they, so I just started saying, hey, I want you to go to all the CMHCs in the state and just take out their peers for lunch and talk to the supervisors. And people are like, well, why would we do that? Do you need to come with us? No. If I go, then I look like I drove them and I'm coaching them.
Right.
But our members drive themselves all over the state and meet with the peers and their supervisors and talk about what's going on there and support them in their mission and what, any way that we can. And sometimes we bring someone from the state to listen to what's going on there and understand what's happening. The people that I'm sending have schizophrenia.
Okay.
And in the mental health world, there's stigma of like, well, I'm depressed, but at least I don't have bipolar, or I have bipolar, but at least I'm not schizophrenia. So when they go in there and tell their recovery story and they got themselves there and they're professionals and they're doing their job, that's proven that the recovery is possible.
Right.
And to me, they're changing the state because people who think, there's someone out here that I can hire to be a peer specialist or knows mental health symptoms. And I'm like, where are you looking?
Right.
There's probably someone in the factory down the road that's managed their bipolar disorder for years that would much rather be a peer specialist and talk about that.
Now, can they recover without medication?
I'm not a pill pusher,
Okay.
and everybody is on their own journey.
Right.
But for many, the medication gives them ability to start working on the theory, on their therapy. Do you need the same medication as you get older and stronger in your therapy? I don't know.
Okay.
You know, that's, but for many people, I think they have to have some medication. It's the first tool in the toolbox,
Right.
so that we can focus and pay attention and have our memories working.
I'm Dr. Swannie Jett, CEO for Park the Ball Community Health Centers. We have our Legacy Gala coming up, and we need you there. Midnight starts performing. We have cocktail hour from 5 to 6. 6 o'clock the program start. I'm your keynote speaker. I look forward to seeing you there. So I'm curious, because, every time I get up to some type of height, I don't know if this might have been something that just happened in my childhood. I get to the second floor, and I look over and be like, I could jump and I probably won't break nothing. I get to the third floor, be like, yeah, I might break an ankle. Get to the fourth floor, I'll be like, yeah, no, I'm not going to do that. What is that?
I have the same fear. If I get on a roof, I think I'm clumsy and klutzy,
Okay.
and I'm going to fall.
Right.
So I might as well just jump and get it over with, right?
Right.
So I'm like, that's a suicidal thought. I'm thinking suicide when I get up on this roof.
Right.
So best not get on the roof.
Don't get on the roof.
Don't do it. Don't do it. And there's other times where I'm comfortable being up high,
Right.
like in a plane, I have no fear,
Yeah.
right? But standing on my roof is
Right.
not the place for
Not
me.
the place to be.
Not to be. And so phobias and what those are, yes, you can do things to work through those phobias,
Right,
but
right.
my knees start shaking and I know I'm kind of clumsy already. So I just think that's just the simplest solution.
Yeah, so, I know you did some interesting things during COVID. And I saw people in some bad places during COVID. I was the health commissioner, and I remember I would talk to people on Zoom. Sometimes people would have their cameras off. I would ask people to turn the cameras on, and I could see in their speech, because they were very high tonal, they normally were not. It sounded like there was an out-of-body experience. Did you notice that a lot during COVID?
Yeah, COVID told us a lot about people.
Right.
It's interesting. I think about some people who still wear masks to this day. What's that? Some people didn't want to wear masks from day one.
Right.
COVID was the first time in our society. A lot of times in the business world, I think about conflict at work, when there's conflict. And it's normally people picking one value over another value. We have to have both values, but they're in conflict. So COVID is actually the easiest way to say it, because it's the first time you have some people that are like, I really need my physical health and I need to be well, and I have all these physical health issues, and if I'm around someone, I could die. So I'm going to pick being alone for my physical health, and that is the value that I'm putting over my mental health. But we're social animals. We need to be around other people. We need to interact with other people. And so I have clients that being alone was actually making their symptoms worse. 90% of what I do is just socialization, getting people to be comfortable socializing with other people. Mm-hmm. And so for the first time, I see these two values that are critical to being human. Yeah. You're healthy physically, healthy mentally. We're now in conflict with each other.
Right.
And so, hey, maybe my great aunt is, struggling with worried about her physical health, and she's isolated from everybody, so that she's safe. But meanwhile, she loves being around other people, so her mental health is deteriorating. Mm-hmm. So, which one is? But as a society, we had to deal with that.
The strange thing, because I was quarantining patients, putting patients in isolation. So I'm on the phone all day, and my staff was too. And I came to the realization that I don't need to be around a lot of people. I was like, I am not a social butterfly. I
Right.
can be at home, smoke cigars, and work, and don't know. I might need to go eat and talk to somebody, but no, I was perfectly fine.
Right.
But a lot of people couldn't deal with it. So,
Right.
but that was my norm. I would go to work, talk to people, go home, not talk to nobody. So I don't know what that was, but I found that out during COVID.
So people, they were like, I was much more productive during that time.
Yeah.
Being at home, no one's there,
I
blah,
worked
blah, blah,
18-hour days.
right? I mean, some part of me, like, going to meetings all day, it's my hobby.
Right.
So when I go to meetings and, like, I tone out, I just,
Yeah.
I'm like, my mind goes off this way while the group is going this way.
We're doing art therapy in a meeting.
So I can go, hey, what was they talking about?
Yeah.
And get caught up to where everybody was, right?
Yeah.
So then you're like, well, how do you do that on Zoom and stuff? So I had to use my daughter to kind of help me
Right.
get up to speed about other ways of social communication, so they got Zoom going on, but they're really communicating. My nephew's, by Fortnite is how he's communicating with his buddies while they're in class with Zoom.
That's funny.
Is Fortnite a game or is it a way for him to communicate with his buddies?
Right.
It's whoa.
Right. Yeah, and I always see people multitasking
Right.
on Zoom.
Right.
That's where I had the camera off.
So as a teacher, you're like, oh, we all need to stay focused. But then I realized, hey, those side conversations are important to us.
Right.
And those kids may be like, oh, they're not paying attention.
Right.
But they are paying
But they are
attention
paying
because, they're trying to
Yeah. That's the interesting thing. So have we recovered from COVID?
Well, I say this about what 9/11 did to transportation. COVID has kind of done to the job market. It's really changed so many things about the job market. You had salary changes, the need for more therapists. People, we had the reckoning, and then so the police department needs more therapists and schools need more therapists. Yes, they do. And so those are all, did it happen because of COVID or was COVID instrumental?
Yeah.
But it's all,
It was always in the underbelly of the country.
correct.
Underdiagnosed, misdiagnosed.
Right.
And COVID just brought out all the uglies. In any major disaster or epidemic or pandemic now, the uglies that already exist are exacerbated.
Right.
And that's what people don't understand. The problem of mental health is 3 times larger than probably me and you will ever know.
Right. I mean, one of the things I've heard from managed care is that we have more peers in Kentucky than any other state, and that some bad actors are overbilling for those services. But if you look at a patient and that person's in need, and especially if they're young in mental health, they may not be aware of their symptoms and how those symptoms are affecting them and their families around them. Someone that's really ill is like that alcoholic who the family would like them to manage their mental health and be a participant in the family. And it takes a while for that person to understand that, hey, this is a problem. But I think we can look at that too in our society, where you see geographically areas that are unable to really understand the situation. We can look from outside and look and say, hey, there's an area in this community, but those people in that community are just doing the best they can to make what they can with that. And as a society, don't we owe those people in that community? If they were a patient, we'd go in there and try to help them.
Right.
So why aren't we helping these people in these communities that are really, really struggling and bring them up and raise them up, instead of, a lot of times we just put more rules and regulations and makes their lives harder.
You know, the interesting thing, I made an observation years ago. I said the Iraq war and war in Afghanistan, we're going to bring tons of people back, military servicemen with serious mental health issues, right? And I think we're starting to see that come to fruition.
I've tried to provide free services to the VA, our cognitive enhancement therapy, where I talked about the brain wiring. Think about it, if you're on patrol every day and you're driving, if you see something on the trash that could be an IED, you need to react. If someone jumps out at you with your gun, you gotta react, right? So every day that you're on patrol, you're wiring your amygdala to go right to your brainstem, because that is what being a good soldier is. It's reacting immediately when you see a threat. Nothing wrong with that.
Right.
But you come back to the States after multiple tours, the longer you're wiring your brain. You come back from that, you're driving up to UofL to take a class. You're gonna notice every garbage can that was off place, everything, because that's what your brain's been wired for. But when you get into class and now you're using your frontal lobe to think, your brain's been wired from your amygdala to your brainstem. It's not wired to think right now.
It's
And
more
so
reactionary.
that's where I felt like cognitive enhancement therapy is a great way for these soldiers to come back and become civilians again. And they can do it, and we have the technology and the ability to help these soldiers rewire their brains and become citizens again.
At Park Duval Community Health Centers, we go beyond medicine, breaking barriers to care across Louisville, Taylorsville, and Eminence, Kentucky. From primary care and dental to behavioral health and pharmacy support, we serve thousands, many facing financial hardship. With 7 locations and a bilingual staff, we welcome everyone because PDCHC, your health is our mission. We are Park Duval for everybody, everywhere.
I always say, and maybe that's just me, I tell people that, you have people that go from one relationship to another, and they don't take the time in working on themselves. Like, you got to be whole first.
Right.
And love yourself first before you want to be in love with somebody else.
So where is Louisville? How are we ranked? Sometimes I think about this, and maybe I'll answer this question this way. And I gave a conversation to the Art Therapy Network about it. When we are, how do you know, if Kentucky is ranked 45th for so many different things that are not good,
Right.
what would it be like to be ranked in the top 5? Now, with the Affordable Care Act and stuff, Kentucky moved up. With what happens to Medicaid, we'll see what happens.
Right.
Because currently, the Kentucky's budget is $14 billion, and we get 14.7 in Medicaid funding. So what happens to Kentucky? I don't know, but I can say this. So how do I know as a therapist what my experience is like maybe compared to other places? So Louisville started art therapy in 1969. We have the first graduate school for art therapy in the country.
Right.
UofL started right here. It started this profession. We probably have more art therapists per square mile than top 5 places in the United States.
Wow.
Okay, a lot of art therapists are here in Louisville. Louisville is known for conventions, right? We have the Expo Center right here, and then the Convention Center down, out there. We have more square footage than top 5 in the nation, top 6 for sure. I mean, you got Orlando out there, you've got
Orlando's huge.
Yeah, so Las Vegas, we're not, but we have huge amount of convention space. we don't have enough hotel space to accommodate that. That's
Right.
one of our things. We need more hotel space to balance that. So many, many different people from all over the United States come to Louisville because we are a 2-hour plane ride from 75% of the nation. And so people all over the nation, like they go to Las Vegas or go to Orlando, they come to Louisville for conventions. I've been an art therapist now for 29 years. Never had the national convention here in Louisville, Kentucky. So we have one of the top places for art therapists, one of the best places for conventions, and never had the national convention here. Why is that? And that is because it takes therapists in that city to plan for to host that event. And every therapist is so busy doing their work, going home and writing notes in the evening, that they don't have time to plan, right? So that means if we want to go to a convention, we have to pay money to fly to some of these other cities, which costs money. Right. So we're missing out on continuing education, personal development, blah, 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 all these things because we are working too hard to be able to really take time as a profession to further develop ourselves.
So, I'm going to throw a hypothetical out.
Okay.
Right? Because to me, the problem is huge. But if you was to change one thing, right, in this country, what would you do? It's a loaded question.
Well, things are changing really, really rapidly right now.
Yeah, they are.
And what this means for us over the next 3 years, I have no idea. I have no idea what that means for us.
You know, I'll answer that for you.
Okay.
If I could change one thing, I would want everybody to have a very valiant, vibrant, healthy life.
Take care of our health.
Take care of our health. So I always say, take care. Let's put the oral health back into the mouth. Let's put the brain back into the head. And I want everybody to be peaceful.
Yes. Change one thing is just if we could love ourselves,
Yeah,
we would be, yes.
So that concludes the show for today. Thank you for everybody in
Thank you.
tuned. It's been great. Have a great weekend.